The Nurse Theorists, Portraits of Excellence, Volume 2. In this edition, we feature Dr. Nola Pender.
I was born on August 16, 1941 in Lansing, Michigan. I was the only child of Eileen and Frank Blunk. My mother was a stay-at-home mom, and my father worked for Oldsmobile Corporation. I had a happy childhood with lots of attention from Mom and Dad. My fascination with nursing began at the early age of 7 when I went with my mother to visit relatives and friends who were in the hospital. I was too young to visit patients in their rooms, so I stayed in a waiting area by the nurses' station and watched the nurses hustle about. They really looked important, talking to doctors, answering call lights, and taking care of patients. I was fascinated watching them and decided that being a nurse would be very exciting. When I told my grandmother that I wanted to be a nurse, she made me a little white nurse's uniform complete with a cap. I donned my uniform and took care of 11 dolls, my first patients. I would take their temperatures, give them pills, and listen to their hearts. I thought someday I will be a real nurse. While attending Sexton High School in Lansing, I became a Red Cross volunteer at Edward Sparrow Hospital. I loved talking with the patients, answering their lights, and making them comfortable. My parents were very supportive of education for women, and I began planning to attend nursing school. I applied and was accepted at West Suburban Hospital School of Nursing in Oak Park, Illinois. My plans were to complete my diploma program there and obtain a baccalaureate degree at Wheaton College. However, after completing the diploma program, I decided to transfer to Michigan State University for my baccalaureate degree. My advisor, Helen Penhale, at Michigan State was very encouraging and supportive. While completing my degree, I worked as a staff nurse and charge nurse in medical surgical and pediatric units at Ingham Medical Hospital. While completing my master's degree, I taught at Mercy School of Nursing in Lansing. In 1965, after dating for 5 years, I became engaged to Al Pender, a teacher and athletic director at a local high school. We were married soon after. Our honeymoon was a move to Grand Forks, North Dakota, where Al began doctoral studies at the University of North Dakota, and I taught in the College of Nursing. Al encouraged me to start taking doctoral courses. I found courses in research and statistics intriguing. I would not be what I am today without Al's love and support. After 43 years of marriage, he is still my biggest fan. When Al completed his doctorate degree, we moved to DeKalb, Illinois, home of Northern Illinois University. I began a doctoral program at Northwestern University with a joint degree in education and psychology. Exploring theories of learning and behavior perked my interest in the role of the nurse as a behavioral counselor. In 1969, I graduated with a PhD and accepted a position in the School of Nursing at Northern Illinois University. In 1971 and 72, Al and I had 2 children, a girl, Andrea, and a boy, Brent. As we watched them grow, they further energized my interest in health promotion, especially promoting the health of children. I took on the difficult task of being both a professor and a mother. This was not without its challenges. Al was wonderfully supportive, sharing responsibilities for home and family. Between the two of us, we spent as much time as possible with our children. In 1982, I published the health promotion model in my book, Health Promotion in Nursing Practice. I found very special colleagues at Northern Illinois University, Dr. Susan Walker, Dr. Karen Seacrest, and Dr. Marilyn Stromborg. We formed a research team and spent 5 years on a funded grant testing the health promotion model. In 1990, I became the director of the Center for Nursing Research at the University of Michigan. This move seemed like a wonderful step in my career, moving to a research-intensive university. The staff at UM in the Grants and Research Office was wonderful to work with. Further, I was fortunate to have excellent research colleagues at the University of Michigan, including Dr. Sally Lusk, Dr. Carol Loveland Cherry, Dr. David Ranis, and Dr. Deborah Oakley, as well as many others too numerous to mention. I worked with two wonderful deans who were extremely supportive, Dr. Rita Dumas and Dr. Ada Sue Henshaw. I spent 12 years at the University of Michigan. It was a special place to be a nurse researcher. Throughout my career, I've been very active professionally. I was president of the Midwest Nursing Research Society and the American Academy of Nursing. I served as a charter member of the National Advisory Council on Nursing Research and as a member of the U.S. Preventive Services Task Force. As for special events in my life, I received the Distinguished Alumni Award from Michigan State University and hold honorary degrees from Widener University and West Suburban College of Nursing. In 2005, I received the Lifetime Achievement Award from the Midwest Nursing Research Society. Throughout my career, I have traveled extensively, speaking to many groups of nurses and other health professionals. Elle and I love to travel. We traveled with our children to Europe and the Caribbean, and we have visited over 45 countries. Our children are grown. Both were married in the 1990s. Our daughter Andrea is an attorney, and our son Brent is a financial analyst. We now have 7 grandchildren. Andrea and Patrick have 3 children, and Brent and Christy have 4 children. Elle and I enjoy spending time with our children, their spouses, and our grandchildren. In 2001, I retired from the University of Michigan School of Nursing and currently am a distinguished professor at Loyola University of Chicago, where I teach a theory course and scientific writing. My Loyola colleagues, Deans Sheila Haas and Mary Walker, have provided me with the opportunity to continue participating in nursing education into retirement. Good colleagues are to be treasured.
Dr. Martha Alligood met with Dr. Nola Pender on the campus of Loyola University in Chicago.
Nola, I'm so pleased to be here with you today and to talk with you about your health promotion theory. And I know the viewers are going to be so pleased to hear about it in your own words.
Well, I'm delighted to be here. Thank you so much for asking me to share my thinking with you.
Nola, I'd like for you to talk a little bit about how your theory came to be. I think people will be interested in hearing about that.
Well, during doctoral studies at Northwestern University, I had a dual major in psychology and education, and of course, I was really exploring the behavioral sciences. I was very excited about research and theory development, and the idea that patients should benefit from the latest scientific discoveries in the care that nurses provide made a lot of sense to me. So as I finished my doctoral studies and began my academic career at Northern Illinois University, I spent about 8 or 9 years actually just reading everything I could find on health and wellness, self-actualization, adaptation, and as I did that, I encountered the work of Halbert Dunn on high-level wellness. And he was very important as an influence because he talked about actualizing personal potential as part of health. And he talked about the healthy individual who becomes more fully functioning and more mature throughout the lifespan. So I was very interested in his work.
Well, I used the Halbert Dunn book also, so I'm very familiar with that work. He emphasized actualization, as I recall.
Exactly,
yes.
Exactly. And then John Travis was very influential because he wrote about optimizing health and really used the word wellness a great deal, and so I found his works most instructive. I did also encounter the work of Erwin Rosenstock and Jeffrey Hochbaum with the health belief model. And as I looked at the health belief model, which they developed for explaining behavior of individuals in terms of taking action to detect a problem early, I found that it really focused on fear and threat, and the idea that fear and threat motivated actualization and healthy behaviors did not make sense to me. So that model didn't fit. And as I continued to read, I found the work of Dr. Albert Bandura, which at that time was called social learning theory. Now it's social cognitive theory. And I was intrigued by his thinking about how our thoughts and the environment and our behavior ultimately affect our lifestyle and how we carry on our daily lives. And so I really was influenced by his work. I also found expectancy value theory, which I had been aware of for a long time, and the fact that people really want to engage in behaviors that they feel have positive outcomes for them. So as I thought about the undergirding premises and the model I wanted to develop, I really wanted to bring together a positive approach in health-seeking behavior, and that is how I derived and began to structure the health promotion model. So in 1982, in the first edition of my book, Health Promotion in Nursing Practice, I published the original model in that book.
You know, it's interesting because your work was developed in that theory emphasis era, and there was a lot of momentum about theory development at that time.
Well, at Northwestern Behavioral Sciences, particularly in psychology, we were just immersed in theoretical thinking, and I credit that as being very important in my contributions that I have been able to make over time in nursing.
Yes, that's wonderful. That's just been wonderful. When you think about your work, I'm sure there are people who've come and asked you for just a brief overview of your health promotion theory. What I'd like for you to do is to give your brief answer of how you would address those folks so people can hear that kind of a summary of your work.
Certainly, I'd be happy to do that. When I briefly describe the theory, I talk about it as identifying important influences that nurses need to address in counseling individuals of all ages regarding the adoption and maintenance of healthy lifestyles. So it does provide guidance to nurses in their patient education and counseling activities. The model shares some commonalities with the health belief model because in both we're talking about health behavior. The health belief model focuses on protection and prevention, while the health promotion model focuses on health promotion. Their commonalities are that situational influences, the environment is an important influence, and interpersonal influences also are very important in impacting both kinds of behavior. So while there's some commonalities, there are also some differences. And those differences speak to the importance of affect or feelings. And many of the models don't take into consideration people's enjoyment of activities and how they feel about various health behaviors. And I think that's very important. Also, the reality of life is that there are competing demands and preferences, and those competing demands and preferences are oftentimes what derails health behavior activity when that is what the individual had intended to do. So that's very important. And then commitment. We spend a lot of time working with clients, and I encourage nurses to do this, on making a commitment and structuring a realistic plan to develop a health behavior that they're interested in.
Now, it seems to me that sometimes health promotion gets emphasized more in a sociological view, but I understand your work to be very focused on the individual. Would you agree?
Yes, I very much would. People have written to me and said, can I apply this model in the community? And Al Bandura does talk about community efficacy, which is confidence in the self that you can perform the behaviors. But I really tell individuals who write to me that the model is intended to be used as a model for individual and family counseling. Small groups, individuals particularly, small groups, it is applicable, but there are other models that may be much more useful in community settings.
Okay, well that's kind of how I understood it as well. I know your work has had a broad use and has been applicable in many areas. What I'd like you to talk about a little bit is the contributions that have been made and with its use in practice, in education, in research.
Certainly. Research has been the major area in which a lot of work has been done on the health promotion model. I was very fortunate to have excellent research colleagues at Northern Illinois University, Dr. Susan Walker, Dr. Karen Seacrest, and Dr. Marilyn Stromborg, and we formed a research team, wrote a proposal to then the Division of Nursing, what is now the National Institute of Nursing Research, and were funded for actually 5 years of work to test the health promotion model. And we conducted 4 interrelated studies, and that the results of those studies really have resulted in the modifications of the model that have been made. So I cannot thank those colleagues enough for being so special and working with me on that project. Then I went to the University of Michigan as director of the Center for Nursing Research, and there, not long after I arrived, we wrote a proposal for an exploratory center grant, and we were funded for the exploratory center grant, which focused on children and adolescents. And a portion of the work in the center focused on testing the health promotion model with adolescents. While the work at Northern Illinois University had focused on adults, the work at Michigan focused on adolescents. So we looked at the applicability of the model to adolescents. And I had wonderful colleagues there in the School of Nursing, too numerous to mention, but a number both inside nursing and from other fields such as psychology and kinesiology who were involved in that grant. So that research also contributed further to our understanding of the use of the health promotion model in a younger population. And then the first intervention work was conducted by Dr. Sally Lusk, who was a pioneer in testing an intervention based on the health promotion model. And she applied the model in developing a computerized intervention to help individuals in manufacturing and construction industries use hearing protection. And she was looking at not only does it predict use, but then went on to develop a computer-based intervention that was shown to be effective in encouraging workers to conserve their hearing and use protective devices.
Over the years, I assume there were a lot of theses and dissertations maybe that
There have been over 100 studies or more that have tested the health promotion model. And in dissertations, some of them focus on 2 or 3 variables, 4 or 5 variables. Many of them have not tested the entire model, but it certainly has stimulated a lot of doctoral dissertations and postdoctoral work. And then I want to mention the work of Dr. Susan Walker, who recently, prior to her retirement, completed research testing the use of the model with older adults and actually developed an intervention to encourage increased physical activity and improve nutrition. And she found that the model did result in an effective intervention. So her work was done at the University of Nebraska, while Dr. Lusk's work was done at the University of Michigan.
Okay. Well, that's very interesting. What would you say in regard to practice? All these have application in practice. I understand that.
Yes. I've had many contacts, and nurses talk to me about how they have taken the model and used it to develop protocols for patient education and counseling in settings from schools, in industry, wellness clinics, ambulatory care, nurse practitioner practices, other private practices of physicians and nurses. I myself have not done extensive development of clinical protocols, although I have developed a set of clinical questions that are on my website that individuals can go to, and it's a single question that helps the individual to assess each of the influences without using more extensive questionnaires.
Well, I think the clinical questions would be much more useful and better, actually, than a protocol because it will let it be individualized.
Yes.
And that would be important, I think, with your work.
And then in education, I'm very committed to introducing students to a wide range of middle range theories. And I think that's very important. We have focused on the grand theories and some of the theorists who give us an overview of nursing and what it is and how they conceptualize it. But in practice, nurses need guidance in specific patient situations. So the health promotion model has been used and taught as one of multiple middle range theories at the undergraduate, graduate, doctoral levels. And I think that's a very positive direction in which nursing is now moving.
Well, Nola, I think you're exactly right. In my Nursing Theory Utilization and Application book, the third edition in 2006, I actually indicated that we're in the theory utilization era rather than just a theory era.
Well, in education, I tell students research and theories that have been tested in research provide an excellent base for evidence-based care, and we're in an era where scientific discoveries need translation to patient care as soon as it's feasible so that we optimize the quality of care we provide to patients.
Yes, that's right. Nola, do you consider your health promotion theory your major contribution to nursing?
Yes, I would, because we started at the time that it was really cutting edge. We were in the forefront of beginning to focus healthcare on health promotion, and so I think that was certainly a major contribution. Plus the idea that the model is middle range and provides students and nurses in practice with a template for providing behavioral counseling or patient education. I think it has made a contribution.
As we finish this interview, is there anything else you'd like to share with the viewers?
Well, I would like to encourage nurse researchers and students to continue to develop interventions based on the model and to test them with various populations and also in multiple countries. We've had ongoing research in Japan and Mexico and Korea and Thailand and Taiwan. So the model has had use in many countries, but we now need to focus not on the descriptive research, but on the intervention research and developing interventions for testing that then can be translated into practice.
Okay.
And as I work with nursing students today and see how talented and creative they are, I know they have the expertise to do this, plus generate other middle range theories. So I think nursing has a very bright future.
Mm-hmm. Nola, are there other nurses that have influenced your work that you would want to mention?
Yes, I'd like to mention Dr. Beverly McElmurray, who was one of my early colleagues at Northern Illinois University. And as her dissertation, she was focusing on health as the core concept and organizing concept of nursing. And we had many interesting discussions around that idea, and she really sparked my interest and energized me to explore further.
I understand that prior to retirement, you conducted research on counseling interventions for adolescent girls. It's wonderful that Dr. Lorraine Robbins is continuing that research at Michigan State University. Nola, it's been wonderful being here with you, and I just want to thank you for allowing us to come and to do this interview and to hear about your work and how the work has grown and developed over the years. You and I came into nursing at about the same time, so I'm very familiar with the history as I look back, and I know the contribution that you've made is a significant one, and that you led the way into health promotion in nursing, and what a wonderful career you've had. It's been my pleasure to be here with you today.
Well, thank you. It's been wonderful to be here with you and to get to see you again and to talk about the future of nursing and the future of middle range theories.
Thank you.
My faith, family, and profession have contributed immensely to my happiness and fulfillment. I have been in the nursing profession for over 45 years and am truly blessed to be a part of this noble profession.